This is a young female with a slowly enlarging right supraclavicular mass and gradual onset right upper extremity weakness and dysesthesias. The images demonstrate a large infiltrating T1 iso to hypointense to skeletal muscle, T2 stir heterogeneously hyperintense, centrally necrotic mass centered within the right supraclavicular fossa with extension towards the patient's right axilla. Prominent flow voids are identified within the lesion, which does not lose signal on the out-of-phase images. There are numerous sites of diffusion restriction within the nonnecrotic component of the tumor, which also heterogeneously enhances. Soft tissue sarcoma was favored with a final diagnosis of pleomorphic sarcoma following biopsy. Pleomorphic sarcoma, which is also known as malignant fibrous histiocytoma, is considered the most common type of soft tissue sarcoma with aggressive biologic behavior and a poor prognosis overall. Presentation is usually between 30 and 80 years of age, with a slight male predominance. Patients usually present with a history of painless enlarging palpable soft tissue lesions. In this case, the lesion slowly infiltrated and encased the patient's brachial plexus on the right, accounting for the delayed onset and symptoms. Predilection is for the retroperitoneum and proximal extremities, with treatment consisting of chemoradiation therapy followed by surgery. Prognostic factors include tumor size, location, and histologic grade.